Bula and welcome to the Pacific Digital Health webinar series. This is the third webinar series in the monthly series we Beyond Essential Systems have been hosting. I am Safia Noor, joining from the Suva office of Beyond Essential Systems. Today, we will be talking about the Health Supply Hub, an integrated web-based platform to facilitate procurement of medical supplies. Thank you so much to our sponsors, that is DFAT. And at the same time, we would also like to take this time to thank MFAT Newsland for supporting Health Supply Hub. While we wait for a few others to join, I would also like to share with you our fourth webinar series that will be about from EMRs to data warehouses, a deep dive into health data. This will be featured on 10th October 2004. And for the later 2 months of this year, we will be hosting 2 more webinars, which will be about PHIS information sessions and the transition to open mSupply. This session is also recorded and will be available on our YouTube channel. Now let's dive into the agenda for today. As I have already mentioned, this is about Health Supply Hub, an integrated web-based platform to facilitate procurement of medical supplies. The 2 main people who will be presenting this presentation today is Chloe Tinmark and Jessica Jago. They will be talking about procurement, mSupply, tender module, and Health Supply Hub. And at the end, we will also have a demonstration with user experience videos. Now, I would like to take this opportunity to introduce to you our health specialist here at Beyond Essential Systems, who has been based in Fiji for 18 months, working with the officials here and the staff on the ground. Over to you, Chloe.
Great. Hello, everyone. I'm Chloe Dimmick. Hopefully you can hear me now. And as Safia mentioned, I am a procurement specialist, particularly in the area of health procurement, and I have been working in Fiji recently. So the start of this presentation, I'm actually just going to do a bit of a deep dive into what procurement is and particularly about health commodity procurement, just to kind of set the scene for the platform that we're going to talk about, which is Health Supply Hub. So what is procurement? A lot of people think of procurement as just kind of like transactional purchases. You go down to the corner store and you buy some milk, exchange the money, and then you've got your milk. When we think about procurement, we're looking at the kind of bigger, wider kind of concept. Procurement kind of describes the whole buying process over a period of time. So buying both goods and services. It starts with kind of like identifying your needs, kind of analyzing your markets, and hopefully thinking about it a little bit more strategically so you can leverage the money that you have to get the best deal. So this is a simple diagram of the procurement process. There's 3 main stages to procurement. That's a planning phase, a sourcing phase, and a management phase. In the planning phase, that's where you identify you need something. You work around identifying needs of what you want to provide, specify your exact requirements, plan your approach. And then you actually need to go about like, how are you actually going to get this stuff? How are you going to engage suppliers and interact with suppliers? So that's the sourcing part. How are you going to evaluate it? And how are you going to negotiate that so that you actually get the products that you want? And then finally, making sure after all that effort that it's executed well and that you get what you want. And everyone on both sides of that arrangement are happy. The next part we're going to dive into is health procurement. So what's involved in health commodity procurement? It's a little bit more intensive than just that initial cycle that I just showed you. So when we look at health commodity procurement, we really want to like look back at our health services and see and collect the information about the products that we've been using to actually perform those services, make sure that we understand how well the products that we've procured in the past have worked out for us and how well the services provided by the suppliers have been. We need to engage with clinicians to review those products. So often they'll be through processes like essential medicine list reviews, where clinicians identify the key aspects of what they need to provide their health services. So the key medicines to provide quality health services, and making sure that we've got things into consideration, like, for example, making sure that suppliers know that for certain products, we need to make sure that they're suitable to our particular circumstances. So, for example, if you are in a warmer climate, you might be looking for products that can sustain warmer temperatures with their shelf lives and things like that, and making sure that you're procuring in pack sizes that are appropriate to your context, for example. The other really important thing is making sure that you get the quantities that you are going to need over the tender period or period of purchase to perform your house services. And then you also want to make sure that you're going about this in the most strategic way by coming up with a plan on how you're going to get the input from suppliers and make sure that you're leveraging as best you can. And of course, nothing's free in this world. We need to make sure that we actually have the funding available. So there's a whole lot of kind of behind the scenes stuff that actually secure the funds and know that we've got the funds there to actually purchase the things that we need to make sure that we've got the products we need for our health services. So once we've done all that, we enter into that sourcing phase. So approaching the market, and then when we've finally got all bids and things from our suppliers, evaluating those bids, and then negotiating those contracts and making sure that they are fit for purpose, particularly in the health context. There might be particular things that we need to think about. For example, a lot of health commodities like vaccines might need to be supplied cold chain, and there needs to be particular contracts, terms and conditions around those sorts of things. Once we've got to the point that we have identified the suppliers that have offered us best value, and we've negotiated an agreement with it, and it's all been approved by the parties that need to approve it within our own systems, we can then actually start purchasing the products. And so that's when we get into the management phase. So placing those purchase orders, tracking those purchase orders, making sure when we receive those orders that we are getting exactly what we actually procured, and making sure they're of high quality for our health services, making sure we pay the suppliers, and then we need to distribute those goods and get them to the end users and the patients that need them. And once we've done that, we want to feed all of that valuable information back to the beginning of the whole process again. So that is quite a big process to be thinking about, and it's quite complex. And when you have a lot of resources and a lot of people, there's whole teams that do each section. But sometimes we don't have that, and we need to look at solutions to make this whole process more streamlined and easier to do. So here we get into, why do we digitize procurement? So when we digitize procurement, it helps us streamline and standardize our procurement processes, which helps both our internal users and also our suppliers understand our processes. When we have digital solutions, it follows the same kind of format, so suppliers can get used to it, and they're much more likely to comply with what you need. Helps with sustainability. Instead of printing off reams of paper with all those documents. We're saving some trees by having it online. When you involve a computer, you can reduce that human error that's involved in manual calculation or manual manipulation of things like bidding Excel sheets. Overall, digital solutions can provide an improved user experience because it simplifies the process often. There's reduced risk mitigation. There's risk mitigation through digital procurement because it can help support things to minimize your risk. It helps strengthen your connections with suppliers. Often digital tools can help store that information about suppliers and keep you connected to those suppliers, even if their staff change or your staff change. It enhances collaboration and transparency. It's cost effective. And when things are streamlined, it can really reduce those internal approval timeframes. So the big message is digitization of your procurement process really helps you use your resources much more effectively. So when we think about staff time, when we are in a process that isn't wholly digitized, often this is what it looks like as far as the procurement cycle. So a huge amount of time is actually spent in that sourcing phase, the reaching out to suppliers and getting those bids and trying to negotiate those contracts to get the products that you need. A lot of these processes are really repetitive processes that a digital solution can easily do. And unfortunately, when they're really manual, it means you have less time to plan and less time to manage. And those are the key things that you'd want to spend a lot of your time and efforts in, because that's where you're going to drive greater value. So digital solutions help you kind of flip that curve and give you the ability to spend more time in the planning and managing phase, which has more nuance and needs a little bit more of a human brain than an automation. So a kind of important thing to think about is, well, with all these great benefits, why aren't we doing it? So these are a few of the barriers that we understand are part of barriers to digitizing procurement. So sometimes there's a perception that the digital infrastructure, so all your computers, your IT networks, your internet connectivity kind of precludes you from digitizing your process. Another thing could be around the perceptions of the digital literacy of end users. That could be from previous experiences with other systems and not being sure of new systems when they're implemented and not having that support. Another big thing is that data security. Potentially there's been experiences with data breaches, and sometimes there's a perception that when it's manual, those data breaches are minimized. There's kind of a hesitancy to have that kind of remote accessibility that's associated with digital solutions. And I guess the other really big thing is the cost, both kind of the upfront costs of digital procurements and IT systems, and what maintenance might look like. Do you need to upgrade all of your hardware? Do you need to continuously be updating that? Do you need to continuously be looking at greater bandwidth for your internet? And do you continuously need that training and support to actually continue to maintain that digital solution? So this is where I lead into mSupply. So I can't talk about Health Supply Hub without mentioning mSupply first. So mSupply is the logistic management information system that Health Supply Hub integrates with. So mSupply is used globally, and it provides pharmaceutical supply chain and health commodity supply chain management in a variety of settings, and it can be modular, and it can be implemented in national warehouses right down to remote clinics. It can be on servers, it can be on laptops, and it can be on mobile. And mSupply happens to be one of the most widely used LMIS systems in the Pacific. So it was a great place to start with introducing of Health Supply Hub, which is the integrated procurement platform for mSupply. So here we go. So Health Supply Hub basically is a two-way centralized procurement hub for the Indo-Pacific region at the moment. So all countries from around the area that have mSupply can interact with Health Supply Hub and engage with suppliers to the region. And I'll just go through a little bit about what the workflow looks like, and we'll be doing a demonstration at the end of the session. So this is just a basic overview of what the workflow looks like between the two platforms. So you start off with the planning and the creation and the mSupply tender module. So mSupply is a management tool. You can do stock takes. You can identify the items that you need. You can build in your specifications into mSupply. You can identify from historic usage what potential future usage might be. You can look through the suppliers that you've interacted with before. You can outline the conditions for the items that you want supplied. Once you've created the tender in the tender module, essentially it can be uploaded into Health Supply Hub, which is that interface with suppliers. So once it's uploaded onto Health Supply Hub, it can be released out to all suppliers that have registered with Health Supply Hub, and it can be done in both an open way through use another platform or a closed procurement process where you pre-qualify suppliers beforehand. So once the tender or the request for quotes is out in the world, the supplier can go away and see what products they have to be able to meet the demand that you have. They can upload all of the information related to their products and what their terms and conditions may be, and additional information related to their products. They can upload it all into Health Supply Hub, and then Health Supply Hub can hold on to that information, and then that can be subsequently put back into mSupply for evaluation. So think of mSupply as kind of your internal management of your procurement, and Health Supply Hub is that external facing aspect of the sourcing part of the process. So where is Health Supply Hub currently being used? So this is just a few of the countries that have already used it. Fiji was the first country in the Pacific to use Health Supply Hub, and they use it very regularly. And we will fortunately be hearing from some of our end users in Fiji related to their experience.
Hi everyone, my name is Ralph Mario and I work for Fiji Pharmaceutical and Biomedical Services. I am the procurement officer for biomedical equipment. How do I find the Health Supply Hub? At first, like all new systems in learning, we ask a lot of questions, and there's a bit of teething problems, especially for the learner. but as you progress into it, it's very user-friendly. You learn a lot, and it's very easy and very interactive from us, the end user, together with the suppliers as well. Obviously, RFQs were called through emails. We had a list of suppliers and we sent them our request for quotations. With sending emails, we had difficulties in which we had to schedule them manually through Excels. This had time consuming for the quotation officer. We were prone to errors in terms of calculating due to manually entering the costs and amounts and calculating them, converting them from the currency to Fiji currency. We also had difficulties once we've closed the RFQ. We would need to compile them. This would take several days depending on the number of RFQs. With the new Health Supply Hub system, this has decreased this time, in which it has become, we could almost say, within the day we can evaluate. Previously it would take some time to evaluate, but with this the system, the new health supply system, it's all automated, and this has greatly assisted us in doing our RFQs. Thank you.
Right, so that was Mario from FPBS, and now we're going to hear from Nilishni Devi from the Fiji Procurement Office.
Hi, my name is Nilishni Devi, the Procurement Officer in the Fiji Procurement Office based in Ministry of Finance, Suva. SA Government's Procurement Advisory, Health Supply Hub is a platform that connects suppliers and buyers together, specifically Ministry of Health and Medical Services. The Health Supply Hub streamlines the overall procurement process, particularly for the health sector, by offering an end-to-end digital process. Examples, suppliers were previously using an Excel to submit their price list, and now with the help of Health Supply Hub, all the submissions are electronically done. Secondly, in terms of governance, it has increased data security, and it provides transparent process for audit purposes. Some of the benefits of using end-to-end system are: firstly, the speed of tender approval through Government Tender Board is more faster compared to when we were using the non-integrated method. Secondly, it massively has reduced paperwork. Thirdly, evaluation time has greatly reduced from 2 to 3 weeks. Now we can complete a tender evaluation in 5 days. In conclusion, we are looking forward to more robust digital tender solution to enhance public procurement, specifically for the health sector, and a collaborative approach with the health supply team. Thank you.
So as you heard from some of our end users, there's a number of features that have been really beneficial to Health Supply Hub. So it supports transparency and compliance. It's got auditable action logs. It helps suppliers submit standard responses. There's improved communication. You can publish tender-wide notices, and there's automated correspondence with suppliers, so they get the information all at the same time as each other. Generally improved user experience, as it standardizes procurement workflows and reduced human error through automation. It helps retain institutional knowledge with its document management features. And it's flexible for different types of processes. For example, you may want to do a two-stage process, such as a framework agreement where you do an open tender to establish a panel of suppliers that will be pre-qualified for subsequent purchases, because it enables you to manage those pre-qualified suppliers through supplier lists. And looking at some of the things that were perceived barriers, basically digital infrastructure with House Supply Hub and mSupply is that both systems, they can work with intermittent internet. So if your internet is not great, we just need that transitionary internet connection just to upload and download between the two platforms. But once it's uploaded into House Supply Hub, your internet is not going to interfere with the ability of a supplier to participate in your tender process. The digital literacy and adaptability of the system is that, you know, the support is here with both mSupply and BES. It follows very familiar mSupply workflows. As far as data security goes, both systems allow for access levels to be determined by user type. There's obviously audit logs so that you can look back and check kind of who did what, and also where House Supply Hubs are located on the server is an ISO accredited supplier that puts you know, data security at the forefront of its services. And basically, if you have the mSupply tender module, you have access to House Supply Hub as well. So some exciting developments which weren't touched on because they are very recent updates or upcoming updates. House Supply Hub now enables to generate tender invite links, and this is a really helpful update that has been provided that enables link to House Supply Hub if, for example, there is an all of government platform that needs to be used as part of all of government procurement processes. Instead of having an integration between two systems, which can be incredibly costly, and lock in two systems together, House Supply Hub enables that link between the two systems through this generated tender invite link. House Supply Hub's action log has been updated to be much more comprehensive. We also will be having a audit summary report, which will be great for where you're providing summaries of your tenders to decision makers. Another new feature that will be available soon is supplier profiles and purchaser profiles. So suppliers can talk about the business that they provide and purchasers can talk a little bit about themselves and see if those connections match. In addition to this, the inbuilt supplier registration of House Supply Hub will enable that supplier profile to be set up at registration. And another key thing is governance workflows. So if you have a governance body like the Fiji Procurement Office, governance workflows enables them to have a little bit more control over the tenders that they might have jurisdiction over. So those are the recent updates, but there are future developments that are underway. So basically, House Supply Hub currently is being utilised as a procurement platform, but really the future is that House Supply Hub is a hub for all sorts of supplier and purchaser interactions. So procurement is just the beginning. Looking at things like advanced shipping notice management. So when you're making that purchase, using House Supply Hub to interact with the system. So all of those shipping notices go through House Supply Hub into the end purchaser. Integration with regulatory and supply chain workflow management software. So for example, if your country has introduced medicines regulation with compatible systems, it can be integrated in through the Health Supply Hub system. So you can easily cross-check the products that are coming through being offered to you if they've met the regulatory standards. And another thing that, future state might look like is looking at cross-country emergency sourcing and how Health Supply Hub might be able to help out there. Great. Just before I hand over to Jess, I again just want to reiterate thank you DFAT for supporting these webinar series to help spread the knowledge about these systems, and also a big thank you to MFAT in New Zealand for supporting the development of Health Supply Hub, which has really been a fantastic new tool for getting the best of the funding available for health commodity procurement. Thank you.
Thank you so much, Chloe. That was amazing. So basically, who didn't know about Health Supply Hub, now you literally have that explanation of what it is, how it's been used, what are some of the ongoing support, and what are some of the future developments that they would be doing. So thank you so much, Chloe, for the in-detailed explanation. Now we would like to take this time to welcome Jess Jago, who is the project manager and consultant for mSupply Foundation, who will be taking us across the health supply demo, who has been working with mSupply for a large number of years across different mSupply products. Over to Jess for the demonstration.
Thank you, Safia. We have a video demonstration to walk you through. So thank you so much, Chloe, for talking us through Health Supply Hub and procurement. So now let's get to have a look at the platform. Great. So as I noted, I'm from the mSupply Foundation. So we're going to start this off, our Health Supply Hub demo, and jump into what it looks like in mSupply. As Chloe mentioned, we do the tender setup in mSupply itself, which has great features such as being able to auto-generate a tender based on your usage, so helping cut down on quantification and forecasting. Within here, we're able to do planning, so setting the Incoterm, the suppliers we want to invite, and the kinds of items, including details such as what kind of freight, would we prefer sea or air freight. We're able to also really specify comments to communicate with our suppliers really clearly information about the products we want to make sure when they arrive to us, they are what we intended to order. So looking at specific item details beyond quantity and preferred pack size, we're able to set really detailed criteria such as brand preference or specifications about a product. So once we've done all our setup, we're able to upload into Health Supply Hub, as we noticed, and we're able to publish that up to the web for our suppliers to see. So this is what the Health Supply Hub looks like for a purchaser account, so such as the Ministry of Health organisation procuring medicines and consumables. We can see here, this is a draft tender, my example medicines tender, and I've got 3 suppliers invited. Within Health Supply Hub, we're able to also manage parts of our tender, such as inviting additional suppliers, extending the closing date, and we might have needed to do extra checks before it goes live. And also really importantly, uploading all of the tender documentation that needs to be available to suppliers. So some really key common documents could be information about contracts or instructions to bidders so that they know how to engage with your procurement process. So this also has a bit of a document management. So you're not having to email all these documents to all the individual suppliers, and you could potentially miss out a document you're sending to one of them. So the system manages this, and we're able to track and trace throughout the procurement processes to see what documents you've used in the past. This next tab is the Invited Suppliers tab, which is really useful for tracking suppliers and how they've engaged with with the procurement process. So it does let you know when they've actually submitted a bid, which is really handy. And the last one is looking just at our tender item lines. So just being able to double check the items that we're about to request. So right now we're in draft mode. So I might want to do a quick read through and make sure that all the pack sizes and how much I'm requesting looks good. So one of the things, once we're ready to publish the tender, we're going to see it'll actually send an email invitation to suppliers that have been invited. So once we've published, it goes live and people can start to engage with our process. Health Supply Hub actually does automate email notifications throughout the tender process. So it's something for staff that they don't have to worry about the added burden of reminders for when a tender is about to close, when a notice has been published for key information. So the system does that for staff as well. So suppliers are able to now log into the Health Supply Hub portal. So this is what it looks like, very similar to the view I just showed you, but with some key differences. So we can see here, they're an invited status and they've got a quote template. So they're able to see all the key information you've uploaded, including the tender documents, access the quoting template, which is how the information gets imported back in and back down through to mSupply, and also register their intention to bid. So that is a useful way to track on how many suppliers are actually going to engage with your process. If you get 10 suppliers out of 12, that's a good sign that your procurement process is going to have a good outcome. As Chloe mentioned, building in transparency in some of the comms is a really important function. So the ability for suppliers to ask questions through a tracked and auditable process. So in this case, I might want to ask a question whether a capsule or a tablet can be provided for a particular product. And because of this new audit log feature, all of the notices and questions that are asked through Health Supply Hub are tracked and traced and generated automatically part of the audit report. So we don't have to worry about any manual collation if someone's requesting it. Okay, as Chloe mentioned, we have lots of exciting new features coming up. So some of those to support suppliers. So we want to increase the number of suppliers engaging in our region. So a really user-friendly online registration process where they can provide all of their key details that they may wish for purchasing organisations to see, manage all of their users, and also really importantly specify the kinds of business interests. So what types of products that they provide, maybe a link to the website or a catalogue, where they currently are wishing to supply to, and also what types of procurement opportunities. So maybe they're only looking at doing dental products, for example, so you wouldn't want to engage them. And so looking at our next set of features for purchaser organisations, so that's our Ministry of Health organisations or a hospital doing private procurement. As Chloe mentioned, we have a great new invite link, which allows for linking to other procurement platforms, so removing the barrier of having two different systems. We have the ability to set either a tender as having a governance step, so allowing for extra steps in authority throughout the process. And something that I think is really cool is when a tender is closed, the ability to generate an automatic audit report to track all of the key information that maybe a Ministry of Finance is requesting, such as how many people actually bid, what kind of questions were asked, and how many people actually submitted quotes. So I think that's really all for today. We can definitely always do a larger demo. Anytime, get in touch with the Beyond Essentials team or the mSupply team, and we can go in detail with what Health Supply Hub looks like. I'm going to pass back to you now, Safia.
Thank you so much, Jess, for that. That was amazing. Now, I would like to let everyone know that we will have our next webinar series on October 10th, like I have shared. And in regards to this, there were some questions already which have been answered in the chat. But if someone wants to unmute themselves and ask questions, please feel free. We have Jess and Chloe available for you.
Peter Lang here. Just wanted to know when we could expect to see advanced shipping notices or shipping notifications.
Sure. Thanks for the.
Is there a timeline that's been set, and have there been some specifications developed, those sorts of things?
Over to Chloe and Jess.
I think I might be able to take this one, Peter. At this point in time, I would say not within the next 12 months based on the current development planning. However, there has been interest from some external outside of our region in getting this moving forward. So I would say at least 12 months away at this stage. And yes, the specs have already started to be developed on what that would look like.
Thank you.
Jess and Chloe, we have one question available in the chat.
I can answer that. So mSupply is not just limited to medicine supply chain management. You can do a raft of medical consumables and things through mSupply. You just need to make sure that you set that up and categorize it accordingly in your system.
I believe there are no further questions, and we might receive emails now if there are. Thank you so much to everyone who has joined this session and taken out their time. We will see you for our next monthly webinar series. I would also like to show appreciation again to DFAT for sponsoring this monthly webinar series and MFAT Newsland for supporting Health Supply Hub, the amazing procurement system that we have been using now. Vinaka Vakalevu, have a great time, everyone. See you in a month. Goodbye.